Welcome to A State of Mind. This is Julian and Hilary. I have a wonderful conversation and episode today for everyone. It's actually really informative. But before I get to that, just a few updates. I have a new website, astateofmindpodcast.com. If you go to the old website, astateofmindplay.com, you will automatically be taken to the new one. And we've got an update of the logo, some new artwork, and I'm going to be adding an online store there soon to make it easier to order things like t-shirts. We've got a few different designs that I'm excited about. You can also order coffee cups, things like that with our logo. It's a great way to support the podcast. Another wonderful way to support this podcast is just sharing it with friends, sharing about it on your own social media accounts. That makes a big difference. And of course, if you've been appreciating this, please consider going to patreon.com/astateofmind. You can make a donation there, and it really helps out a lot. And as always, you can send messages and questions through our website. I love hearing from everyone, so please do that. If something moves you, let me know. If you have any questions, again, let me know. So today I'm speaking with Hilary Morris. Hilary is a fellow psychotherapist who specializes in helping people recover from traumatic injuries, just healing trauma in general. And we talked in our conversation about physical trauma like a concussion or a brain injury, or being in a car accident, and also the emotional or psychological trauma, and how those two often go together, and how there's a physiological component to each, of course. So it's not like one is purely mental and the other physical, though it can seem that way at times. Hilary also teaches and coaches women to be entrepreneurs, to run their own businesses. It's something she's really passionate about. She shares about that. And she talks about pleasure and the importance of allowing yourself to feel pleasure and ways to do that, and ways in which we tend to block that. And then towards the end of our conversation, she shares about her work with ketamine and ketamine-assisted therapy, which is a type of psychedelic-assisted therapy that is legal and safe. And I really think that this is one of the clearest, most concise discussions of ketamine-assisted therapy that I've had on the podcast thus far. So if you're interested in psychedelics and psychedelic-assisted therapy, please check that part out. I thought it was really good. And without further ado, I bring you Hilary Morris. Here today with Hilary Morris. Hilary, thank you so much for being on the podcast.
Hi, Julian. Thank you so much for having me. Excited to be here.
Yeah, my pleasure. And we both know Craig Salerno in common, who was on the podcast earlier this year.
Yes, Craig is great colleague and does some great work in the ketamine and addiction space.
Yeah, really talented psychotherapist and good with addictions and all that. Do you want to share a little bit about yourself and what you're up to?
Yes. So I am a therapist, and I'm also the founder of my own private practice. And we actually have 3 therapists and a psychologist. And so we've got a group practice, and we have 2 locations, one in Lakewood, and then we just added a second location in Inglewood. And so what we really specialize in is trauma. We do trauma and anxiety and a little bit of depression. And one of our subspecialties is assisting with either accident or injury related trauma. So it's usually a single event trauma, a car accident, a fall, some sort of injury. And we help give clients tools and teach them new things to help manage those traumas and regulate their emotions and really get back to their lives and help improve overall functioning.
Interesting. Yeah. Would that include often like physical accidents?
Mm-hmm. Physical accidents too. Absolutely. Bike crashes, car crashes, concussion. So football injuries. We work a lot with concussion and traumatic brain injury. That's one of our specialties as well. And knowing that when the brain becomes injured, so in the event of a concussion, that actually impacts physiology, neurophysiology, and oftentimes you get a common symptom profile of heightened anxiety, depression, PTSD, because the cells that help regulate emotions have been injured or impacted during that concussion event. So that's what we specialize in, just educating clients on what is a brain injury, what is normal, how to manage it. We work with their families a lot too, and really empower our clients to take their recovery into their hands and teach them new things, give them new ways of thinking, help them access new resources. And it really, really helps them to get back on their feet and just learn a new perspective.
Yeah, that's beautiful. I mean, it's needed work. I just was talking to someone last week whose partner was in a car accident that wasn't their fault at all, and they had a concussion that wasn't that bad, but now they have post-concussion syndrome. And so I'm kind of learning about that for the first time, but the doctor, she was told it could take up to a year to feel normal again. And then some people are kind of in her family have doubted that it's real, so she's dealing with that kind of thing. And because there's nothing physically wrong according to the doctors, but it's a lot of negative symptoms just from dealing with it afterwards and like readjusting. You probably know more about that than I do.
Yes. Well, the thing is, and that's why sometimes they call traumatic brain injuries an invisible disability or an invisible injury, because if you break your arm or your leg, you have a cast or there's some sort of visual presentation to where others can see the injury. But with brain injury, sometimes it's more of a mild traumatic brain injury, and the injury doesn't appear on an MRI or a CT scan. And it can be really challenging because the symptoms are real to the individuals, and it can be difficult for non-medical people or non-concussion specialists or family and friends to understand. And the concussion industry, it's kind of a niche industry. It requires training because of that reason, because it's very kind of misunderstood, and there are certain specialists and specialty doctors. And usually a lot of our clients have a neurologist who's diagnosed the concussion, and then the neurologist will recommend psychotherapy. But it can be really difficult, and it can be invalidating sometimes, and people can feel unseen and unheard and alone in their struggle. And so they find that it is helpful to talk about those struggles in a safe place and learn that there are individuals that can help, and it can be frustrating, and the treatment or the time it takes to feel better, it can vary. I mean, it can vary, and it's based on multiple factors. I think age, the type of head trauma, loss of consciousness, pre-existing conditions, genetic variability, all those go into the recovery process.
Obviously, a concussion then is more serious maybe than people give it credit for potentially. And things like you mentioned football. Imagine just even like kids, if they got in a kind of fight or scuffle, and any kind of thing that could potentially cause a concussion or damage to our brain is potentially really serious, right? What are some of the symptoms and effects afterwards that you notice?
So the most common symptoms of concussion, and it kind of depends, you can actually go into a lot of detail because it depends how the brain was concussed, because there could be a different symptom profile if there is what's called a coup contra coup, so if there's the back and forth versus the side to side, because different regions of the brain are impacted. But I think the most common symptoms would include cognitive dysfunction or cognitive fatigue, so feeling just foggy. Right. Difficulty with executive function, memory loss is a really common one. So people just forgetting to do everyday tasks. Loss of language or difficulty with speech articulation. So word finding challenges, forgetting words, difficulty with abstract thinking. Sometimes if the ocular region of the brain was impacted, visual disturbances are common.
Wow.
So light sensitivity and difficulty looking at screens, so like a computer or a phone. And then there's a typical emotional symptom profile too. Because when the frontal lobe becomes injured, and the frontal lobe being a suppressant for emotional dysregulation, it can amplify emotional responses. So we tend to see a lot of depression, anxiety, hypervigilance, panic, paranoia, and sometimes suicidality too, depending on the severity of that. But those are usually the most common symptoms we see with concussion.
That's wild. Yeah, you just listed so many things. I mean, any one of which would be, a real challenge. But it makes sense that psychotherapy would be recommended then to help. And it's interesting. I mean, my other thing I was going to ask you about this was just this, we can think about trauma in terms of physical trauma. And I think that's, like you said, easier to understand if you have a cast on your leg or if you're in, a ski accident. There's been physical trauma to the body. And then more emotional or developmental trauma. I mean, now there's a lot of people are very aware that that's a reality and that people, need help for that. And that's where psychotherapy and like EMDR, modalities like that can help so much.
Yes.
Do you want to speak to that physical versus, would you call it more emotional or psychological trauma? And there's a lot of connections there. It's not a clear line one to the other, right? Because there are physiological changes in our nervous system when you have been, in an abusive relationship, for example, if you grew up in an abusive environment. So.
Well, yes. And that's actually a common complaint of people that come into our office after a car accident. They'll say, hey, I was in this car accident. My body's fine. I'm okay. I didn't have any major injuries. And sometimes people don't even have a concussion. They'll just have a car accident and then all of a sudden develop symptoms of panic or post-traumatic stress or anxiety. And the reason is that trauma remains in the body, emotional trauma. And with one of those incidents, so with a car accident or in an abusive relationship or some sort of trauma, how we explain it to patients is we have a threshold, an emotional threshold that our emotions allow us to experience in the day-to-day realm. And we might have some days that are great and we're feeling good, and some days are a little bit bad. But for the most part, we have this euthymia is kind of what we call it. We just stay in this good little area. And then what happens with the emotionally traumatic event is that threshold, we exceed that threshold of what we normally can handle because of the heightened emotions. We have a cascade of these stress hormones. In some incidents, the accident mimics death. And so while we don't die, the brain thinks we're about to die. And so our nervous system, our limbic system, which is neurochemically where we experience emotional trauma, it exceeds what we normally have capacity for. And the body remembers that. It's almost like it cements that traumatic incident and then everything surrounding that incident, thoughts, feelings, behaviors, even evocative cues that are reminiscent of the event. So if it's a car accident, if it's like a traffic light or a certain type of car, the body remembers those things until we train it to not, or until we desensitize that. And so I think that, yes, there can be physical injuries present. And also because of the magnitude emotionally of that traumatic event, it kind of remains in the body and it gets absorbed in the body. And so our approach, we use a combination of many different modalities depending on what the patient presents, but we do the cognitive behavioral approaches, we do the desensitization approaches and the exposure therapy approaches, but we also do a lot of somatic approaches too, because for clients that can handle that. Yeah. So to just get them really in touch with how their body is experiencing that trauma. And a lot of times that comes with connecting. So connecting with what they're feeling in the moment, the panic, the anxiety, the paranoia, and staying with it. Yeah. We teach this concept of pause, try to learn to pause and stay versus getting lifted into this almost tornado of anxiety and panic and flashback, and it kind of lifts you from the body. So we really teach to try and stay with it with all sorts of approaches, and we do use EMDR as well, but just to allow the body to compensate and to kind of desensitize and to allow the trauma to kind of move through the body really gently, and have patients kind of get back to functioning before the event happened.
That was well said. That's a good description. We're fortunate that there's so many therapeutic modalities, types of therapy that can help people. It can also be confusing. Would you say it's fair to say that cognitive behavioral therapy is operating more at the level of thoughts and like working with our thoughts?
Yes, I think that's great. That's a great description. It's sort of like cognitive behavioral therapy really uses the frontal lobe and focuses on thoughts and how thoughts and feelings and behaviors are connected. And it works for some people and some levels of trauma. And then for other levels of trauma, we sink deeper. And if you think about the brain too, we move from the cortex or the frontal lobe, we move deeper with the somatic therapies and even the exposure therapies and desensitization. We move into the limbic center of the brain and really get to know and process and kind of release and resolve traumas on that level. And it's almost like we use this metaphor with our clients, but it's almost, and for some people, we have to learn a new language because we're so equipped with learning language of cognition because we use it all the time. Right. And so learning to sink into the body and get acquainted with the body's language through feeling, emotion, somatic sensations, and is totally different. And so it's really fun to teach people how to kind of turn off the brain and kind of live from the neck down and just get to know this new language. And we have different exercises for how to do that. One of my favorites is to connect with this part of your body. What is this part of your body saying? What does the sensation look like? What does it feel like? Does it have a texture, a color? Does it have words? Is there something that needs to be expressed? And just sitting with it, just sitting with whatever's coming up.
Yeah, and that can be so challenging because most of us are so conditioned to always be doing, going, and to slow down and drop in. And I like how you said deeper, that accessing our somatic experience, dropping in, I think potentially can be healing on a deeper level. And but to honor both our cognitive processes and all our somatic experience and all of that is important. And
yes, and I think teaching. Oh, go ahead.
I was just going to say, I think it would be, very fair to say in general, our society tends to live in the head and we're disembodied and we're disconnected from our embodied experience. And there's so much there. And that can be a huge part of healing and becoming a more integrated, like holistic person. But I do occasionally meet some people because I live in Boulder and I've been in the meditative kind of yoga therapy world for so long, who I think are kind of so biased towards the body and that approach that they then maybe need a little bit of more cognitive, like working with your thoughts, thinking logically, seeing things more clearly. So I think it's good, that balance, and be able to have all of that working.
Yes, I think that's great. You said it beautifully, to have an integrative approach and to have a balance and to use and learn both. And there are just some of us who are kind of top heavy, and that's just naturally how we work, myself included. I'm just kind of analytical and more cognitive. And then it's all about balancing it and learning, okay, if I take a break from cognitive processing, what is my intuition saying, or what is my body saying? Because so often I think we don't give that enough credit, because I really do think that, and we teach this too, I really think that we know if people come to us saying like, oh my gosh, I'm stuck, I don't know what to do. I think we know, just intuitively, we know the answer. It's just kind of clearing out all the things that tell us we don't, trauma included, and raising awareness to disillusioned beliefs or beliefs that might tell us, oh no, just, you don't know, you can reach out to all these other people and these other methods, but deny yourself. And so it's all about integrating the body, the wisdom of the body with the wisdom of the mind to create this holistic perspective on health and healing.
Nice. Yeah, I think we're on the same page there. That's good. Mm-hmm. Well, do you want to share a little bit with us about your life and how you came to be so passionate about doing this work?
Yes. So I really like people. I've always liked people, and I've just been really fascinated with the mind and the psyche and change. So getting into psychology of change and just why certain people and certain conditions do and why certain don't. And so I decided after, I think I decided when I was living in Boulder that I wanted to explore psychology as a career and take that into my vocation. And then it's interesting because the more advanced I got into the field of clinical psychology, which does teach evidence-based approaches, meaning the cognitive behavioral therapies, and it didn't teach as much of the somatic approaches. And I started to get fascinated with some of the approaches that involved the body, or like we talked about, that went a little bit deeper. And so decided to get trained in more of the holistic therapies, just to have multiple options for people, because there were people that are great and were using these cognitive approaches, but getting stuck or only getting to a certain threshold with it. So by adding more therapies, the somatic approaches or the emotional approaches, we can see clients healing more quickly or more rapidly than just one approach individually. And so that's sort of what got me interested in therapy. Just I really like people, and I like change and transformation. And then I also realized the more and more I got into therapy, my desire and passion for, I guess you can call it entrepreneurship, or the kind of the business aspect of having a practice, that just came, I don't know, I just really liked that. And so this path that I'm on, it kind of combines the best of both worlds, where I can engage with people and help them, and also build this practice. And that's actually something that, just because I think that, well, for me, I was just intrigued by how to build a practice and how to build a business. And recently it's interesting because I've kind of built up the practice, and also kind of attracted into my client base individuals who are sort of on a similar path. We work well with women or those who identify as women in the entrepreneurial space. And so that became part of my passion too, is just assisting or being able to combine all of these things, the therapy approaches, somatic approaches, alternative approaches, to assist those who identify as women in this unique path of owning a business or owning a practice, while also juggling the role of spouse or partner or mother or all these things, because it is a kind of unique place to be. So that sort of led to this other area of growth in me. Was kind of, and I realized, I think a couple of years ago, I was like, I think just staying in the therapist role for me, I was content, but I thought I was made for more. And so that's been interesting, just integrating that and exploring new things and integrating that into my work as well.
That's great. Yeah, it's inspiring to hear. I think, obviously, like, all the business skills and running a business are separate than all the therapeutic skills, and a lot of us
and they don't teach us that.
World are, trying to do both.
Right. And it's so interesting. I wish they would have taught like a business course in like the degree program, but they don't.
Right.
So we kind of just figure it out on our own.
Yeah. And has that been your approach, like kind of figuring it out as you go along, and you're now helping other people to learn those?
Yes, I think that I've learned a lot, probably as you have too, just with what works and what doesn't, and made a lot of mistakes and done a lot of things that are really helpful and really additive, but then things that I've learned from. And so I think that, yes, it's just something I enjoy, and I always try to grow and also get counsel from others too, who are a little bit further or further down the line in their practices as well. But it's an adventure, I will say that. And it's very unique. I think you probably can relate because you have your business too. It's just a very unique adventure, kind of being the business owner and also having a lifestyle. So.
Right. Yeah. And do you want to speak a little bit? Are there specific challenges you see with women that women face, or differences? Like you're helping particularly women entrepreneurs to get their businesses going?
Yes. Well, I think some specific challenges. Well, I think statistically, just based on Small Business Association statistics, there are less, just from a numbers perspective, there are less women who own businesses as opposed to men. So I think there's just less of us out there. So to provide support and kind of band together, I think can be really helpful because it is kind of a non-traditional lifestyle. And I think women, it can take a lot to run a business. And I talk a lot about masculine versus feminine energies within all of us. So masculine meaning more leadership, initiation, productivity, kind of go, go, go. And then feminine being more softness, flow, creativity, sensuality, surrender. And I think a lot of women, they tend to have naturally a lot of that masculine energy because it is required to run a business in the day-to-day and to have a successful business. And the women that I've worked with, they struggle to augment or balance out that feminine energy because so much of their time and attention and energy and focus is turned to running this business. And so a lot of the work that we do is balancing the two, and how can we open up space for the feminine, for energies of softness, of tenderness, of creativity. How can you create space for that while also running this business that can be consuming? And so that looks different for every person. And one of the things I like to ask is just to think about the last time you lost track of something and did something you truly love. And another thing that I love to ask, which is really fun, is to create a block of time, either a day or an afternoon, of no plans. So, which can freak out some people, but you just open up to whatever is coming up in the body, to tend to that. And for some people that can be just doing some dance. For some people that's taking a bath. For some people that's just waking up late and watching the birds outside. For some people it's doing some creation, whatever that looks like, but just to get in touch with the feminine. And it looks differently for each person. But I think that it's, in the women I've worked with, it's just very unique. And I think that it can be easy to kind of get stuck in all of the masculine energy because running a business takes a lot of time and effort. And especially with women who have multiple roles, they can feel disconnected from sources of love, joy, pleasure, purpose. And so it's all about coming back to that and really connecting with, okay, what does pleasure feel like? what things can get me to a place where I can have this, where I can feel encouraged and lifted up and refreshed. So it's just a lot of fun, and it's an honor to be able to work in that space. And I can relate on so many levels because I also have a business and a practice, and also, so I'm learning this firsthand too.
Yeah, no, that's beautiful. I like what you said about how we all have masculine, feminine energies and those different qualities. And I think I totally agree. Like having unstructured time, I think it's important, and it can be challenging for people. And I think, myself included, like there's this endless to-do list for better or worse. Honestly, I think it's mostly for the worse, but like our society is like more, there's, things like social media and email and website stuff and marketing, and there's like an endless, number of things that you could be doing. And I think having the skill to be able to put that aside and have some time off, so to speak, and then come back to it. I found that when I can do that and things are flowing well, I can then return to that kind of stuff with a much greater sense of flow and energy, and kind of just knock stuff out and get it done, and doesn't feel like this struggle or slog as much. It's an ongoing practice, but to be able to find some of that balance, like just yesterday, I went for this big hike all morning. Drove up high, no phone service, and I'm just outside with my dog. And then when I came back, I just felt so much more clear and energized, and like things that I had felt like so much resistance to felt a lot easier. So
that's wonderful. Yeah. I love that. Yeah. And I think one of the other things that my clients lean into, and myself, is this concept of who are you when you're not a business owner? Who are you when you're not a mom? Who are you when you're not a therapist? That was a big one for me that I've been learning, is that me as Hilary will always come first, and I can only be as successful as a therapist and as a business owner if I'm tending to me. And so that's a really interesting one too, is just who are you beyond all these roles? And there's a lot of freedom in that too, because so often, think about if you have a child or you have a spouse and that's kind of your primary role is mom, wife, business owner, therapist, healer, whatever. And then who are you beyond that? And I think there can be fear, because so much of our identities is what we do, but then also it's like, oh, I'm actually really soft. I actually have tenderness. I actually want to be able to go to the mountains with my dog and just disconnect and just really connect with the spirit and nature. And it can be really, really lovely and really wonderful to get to those depths.
I just thought of one other thing I was going to share. Like when I went out yesterday morning with my dog, I intentionally stopped, and sat by a creek, and because I think I noticed even when hiking, for example, it can be in this go, go, go mentality, how far, how fast, can I get up to this peak or whatever it is, and to be able to just put that on hold and be out there. There's this whole phenomena that started in Japan called forest bathing, where people just go out in the forest and basically just lie there. You kind of do nothing for a little while. And it's the idea is you're not trying to get exercise, or you're not trying to do anything particularly, just being out there. And I think that can be so restorative.
Yes, I love that. Just to be without any agenda, without any sort of goal in mind or any metric to check off, but just to be.
Yeah. And I like too that you're helping teach people about running their business, and you have successful business experience yourself with real skills, doing psychotherapy. There's this kind of joke that I've seen roll around Facebook, and because I know a lot of people in the coaching world, and he's so people will joke, oh, you're a coach who just teaches other people how to coach, but you've never, had a job or real life experience, So it's refreshing to talk to someone who, you kind of put in your work. You went to graduate school, you're offering valuable skills that can really help people on a deep level, and then adding the business piece on top of it,
Yes. And sometimes too, I think that So much. So someone can come to me for a challenge, and so I'm trained in psychotherapy and these evidence-based practices, and sometimes sometimes someone can be blocked and they don't know why, but then we can use protocols with EMDR, or we do brain spotting a lot here too. And then I think it's all related. So if you're feeling blocked at work or blocked with a performance issue in your job, there's usually something deeper. And in our world, it can be trauma, or it can be energy that's stuck that just needs to be tended to. And then it's sort of like, if you do the kind of the deeper work and kind of face the difficulty, then it also resolves the performance issue or the business issue. So it's interesting. Sometimes people will come in having stress with work or stress with I don't know, performing or stress in that level. And then we just go a little bit deeper and we do some of the therapies, and we really go into some of the roots behind their stress. And then it's almost like you go deep to where the root is, and then it solves kind of the surfacey thing. So it's just fun to do that too.
That's great. You mentioned, do you want to share a little bit of, like, what is brain spotting? I don't know much about that.
Brain spotting, yes. So EMDR, the eye movement desensitization reprocessing, that's probably the standard trauma treatment, and one of the standards. And then brain spotting is a subtype of EMDR. So it uses very similar principles. It's its own method. And David Grand, he was the founder of brain spotting, and he and Francis Shapiro, the EMDR founder, they were kind of colleagues and coworkers and worked together in a lot of these things. So the brain spotting is very similar. The main difference, so with EMDR, you use eye movements to go back and forth, or auditory tones, or tactile tapping while the client is activated emotionally. And with brain spotting, you get the activation, and there's bilateral music. That is the bilateral sense. So it's music. And rather than the eye movements being bilateral, you use a pointer like this, and you have the client follow it with their eyes, and you look for eye movements or facial expressions that show activation, and then you stop them at that point. So the memory is activated while the music is playing, and you kind of you go very slowly, and you go across their field of vision horizontally and also vertically, and you find the spot, because the theory is there's different spots that are correlated to different memories, and then the patient processes while at that spot. So it's very, I always preface it by saying, this treatment, you won't be looking at me while you're processing, and that's kind of wild for people because it's a little bit awkward because you're not looking in the eyes. You look at this pointer, and then I instruct you for what to do, and then you process while fixed at the pointer, and then you do various different things with your eyes. So it's just a different type of modality, very similar. It's still a desensitization, reprocessing trauma. And in our experience, or in my experience, it can be a little gentler. And I'm not trying to start a debate. I know that this is a debate among therapists, which one's better. And I think they're both really good, but I think the brain spotting can be more gentle, especially with traumatic memories that involve some sort of shame or guilt or maybe complex trauma. Because sometimes the eye movements with EMDR can be overstimulating. And so I think different cases can require different treatments, but I like the brain spotting. It's very, it's gentle, and it still is very effective. So
that was a great description. Modality. Yeah, I'm trained in EMDR, so it's interesting to learn more about that. And
have you heard of brain spotting before?
I've heard of it, and I've looked into it a little bit, but that was a good description. And I think it's fascinating how the eyes, obviously have this connection with our nervous system and our brain. And just another example of that is in in meditation, like the way where you place your gaze can be an important part of a practice. And like a simple example is like if you're feeling really sleepy or tired, like look upwards. Or if you're feeling really agitated, look downwards.
Oh, I like that.
Yeah, just doing that can help regulate.
That's wonderful. And you'll start to notice, it's interesting now that I say this, you'll probably start to notice it a lot, but if you have a client and they're talking about a memory, watch their eyes, because sometimes when they're talking about that memory, they'll be talking, and every time they talk about the memory, they'll be looking this way. And to me, as a therapist, that's a good indication. Okay, when we brain spot, that's probably where we're going to stay. But it's just interesting. Or they'll look up like this when they're talking about this specific memory. But it's so interesting. Or there's spots for resourcing. So when someone's talking about being calm, like you said with the meditation, it might be looking this way, or up there, or down there. But it's just fascinating.
That is fascinating. Do you know, are you familiar much with NLP, neuro-linguistic programming? I think they work with the eye movement.
Not much. I don't know too much about it. What is your affiliation with it or knowledge?
I was just curious. I don't know a ton about it myself, and I've read like mixed things about it from a more scientific, objective, point of view, but I think they try to kind of reprogram people's, and they use like the eye movement in a similar way.
Oh, interesting.
Maybe more in an active, intentional way. I don't know. I should learn more, but something like that. That you can access your past, for example, by looking up, I think up to the upper left, like things like that. Oh,
no, I haven't heard about that. That sounds really interesting, though.
Yeah. Well, another thing I wanted to ask you about is pleasure. And you mentioned, I think before we started recording, but that trauma could block pleasure. Do you want to speak to that a little bit?
Yes, I think that, I think we all desire pleasure, joy, vitality, richness, and sometimes different things can block that. Trauma being one of them. I think so many things, underlying medical conditions, stress, anxiety, depression. But I think that, we have pleasure centers, and I think a lot of times we all, just as humans, we desire more pleasure in our lives, but it's hard to know how to get there. And we can feel blocked. And so if someone comes to us, and then this is how we work with them is and again, I think we all know intuitively what we need in order to experience more pleasure. Maybe we need to be working less, or we need to take care of ourselves, or we need to go to the gym, or we need to prioritize date nights with our partners, or whatever it is, we just don't do it. So it's just opening up and being honest, and even asking the body. So covering your eyes, setting maybe a time to go inward and just ask your body, what do I need to be more connected with pleasure? Because it's so interesting how often in the clinical space and as therapists, we focus on anxiety, depression, and managing those things. And okay, let's manage and control your central nervous system. Let's really talk about this anxiety. Let's process the trauma. Let's focus on the depression. And then it kind of stays there, but there's not a space to talk about, okay, what's on the other side of that? How can you use all of these clinical skills and this therapy to augment sources of pleasure and joy in your life? So once you've got the anxiety regulated, then what does it look like to open up to experiencing more? Maybe it's better boundaries. Maybe it's, this is one of mine. I recently set a boundary to take my work email off my phone and not check it on the evenings and weekends. So what do I need in order to sink into sources of pleasure, so that when I'm not working, I can really focus on my self-care, my activities, my physical fitness, my relationships, and those can really enrich me. So it's almost about, yes, it's good to kind of manage the depression, anxiety, stress, all that. And in doing so, how can that then translate into accessing deeper sources of pleasure, because we all want that. I mean, wouldn't that be great if we were all just these pleasure-filled beings all the time? And that's not realistic, but if you can start to access that more, that becomes its own medicine, and that becomes its own approach for managing the stress or the anxiety or the difficult situations. And so, and again, it looks different for everyone. So for some people, it might be setting the boundaries. For some people, it might be setting the date night and actually getting a sitter, setting the date night and doing it, even though there's never enough time, but doing that. For some people, it's doing interpretive dance or really connecting with energies and movement and being expressive, and but really prioritizing and asking yourself and being honest, because sometimes in order to experience this deepening of pleasure, it takes doing something really hard. It takes maybe, I need to work less hours. I need to,
and that could be really hard. Yeah.
And that could be really hard. Or this situation is draining, or this actually relationship or friendship isn't moving me forward. So maybe I need to reevaluate this, or maybe I need to set a boundary and say no to certain things, or maybe I need to say yes. I'm a person, I'm learning to set boundaries professionally and personally, and that's been hard but good. And so it's not all rainbows and butterflies. Sometimes the thing you need to do is really hard for you, or it's just saying no to maybe some social events in order to say yes to, I've got to get to the gym, I've got to make a nice nourishing dinner, I've got to just have introspective time. It fluctuates based on the person, based on the day, but I think we know intuitively. It's just learning how to listen and trusting the body and not feeling guilty about taking time for yourself.
No, I love that. I think this is such a big, important topic, to be able to feel pleasure and feel good about it. And you like you just said, that I think many of us are conditioned as children to associate pleasure with guilt, right? And then we have to
unlearn that. Interesting.
Yeah, and we kind of train ourselves or get trained to work hard and do the things we need to do, and that's good, but not if it's coming at the expense of enjoying our lives and being able to feel pleasure. I mean, ideally they can go together. Like you said, going to the gym can be pleasurable, and that's true. And that's kind of maybe a little counterintuitive, because it's something that might be challenging and difficult, but then the result is you feel better.
Yes. Or even getting up at the same time each day, or going to bed at the same time each day.
Yeah.
I think it's great. And also this, just like you said, associating guilt with pleasure, also this, I don't know where it comes from, but this pleasure is earned thing. It's like, I get pleasure only when I do. And I used to do that too. I can really rest when I just kill it at work, or when I just crush it. It's like, I think we're worthy of pleasure just because, not because of anything. It's like, we're worthy. And even if you haven't accomplished as much as you want to accomplish, you're still worthy of taking yourself out to dinner, or going to the gym, or having the glass of wine, or not having the glass of wine, or whatever it is. Yeah. We're still worthy of it just because.
Totally. Yeah, I agree. It's an interesting thing to think about. And I like how you're kind of throwing out all these options. Like, it could look so many different ways, and any one of those options could be pleasurable or not in a given situation for a given person. Like, there's not like some answer. It's interesting for me to think about, like, something like, it could feel really good to like lie in bed, for example, and relax, and that feels pleasurable. But if I did that for hours or a day or 2 days, I'm going to feel terrible, right? The pleasure is going to be gone. So kind of life is like that. Like, any one given thing will feel good for a while, but obviously if you overdo it, it will lose that. And maybe that's where addiction can come in too. Like, you're actually losing the ability to feel pleasure from something that used to give you pleasure. But
yes, I think moderation is great, and asking what it is that you need for that day and how long. And I think intuitively we know. It's something that we know.
Yeah. It makes sense too that you're bringing this in with the helping people with their businesses, because I think to make it sustainable and to actually even have greater success, we need to be able to feel pleasure and feel good about it. And like, you can't do the like long, hard slog forever, right? Maybe it works for a while.
Mm-hmm. Yes, I think so too. And I think the opposite impact is burnout, because if we don't do that, then it leads to just crash and burn, and then we get sick. It leads to sickness, and then you have to take days off to go to the doctor and just be sick, and then it impacts immune systems. So it's almost like you kind of have to listen, and you have to make room for it, because the alternative is just being so stressed out and so just disconnected from self. And that's not fun either.
Totally. Yeah. Well, I'm aware of the time, and there's one other thing I was going to ask you about, and it actually ties in with pleasure in an interesting way, perhaps, but that was psychedelic assisted therapy. I know you work with ketamine. Do you want to share a little bit about that? And I just said that thing about pleasure because I think we don't have to talk about this a lot, but I think part of the war on drugs and all that was like this suspicion or this guilt that if something makes you feel better, it must be wrong in some way. And I think as a society, we're starting to question that and come to a new understanding, I hope. So.
Mm-hmm. Yeah. So I think that's great. And I do think the war on drugs is, can be misinformed. And I also think that I'm really, really excited about the path that ketamine is paving. And that's one of the reasons I am so passionate about it, because it shows us that, yes, this can happen within the context of FDA approval of medical necessity. And then that paves the way for the MDMA and then the psilocybin and all these things that are in trials. But yes, so I do think that it's so interesting, because we talked about the cognitive behavioral therapy with the brains is here, and then we have the somatic is in the limbic system, and then to go even deeper, I think the psychedelic approaches can go even deeper for those who feel the calling to it. And the way that I work with it is a little bit different. So I work in a system with a psychiatric nurse practitioner who pre-screens the patient to get the therapy. And so it's not the first pass in the way that I do it. If someone needs ketamine for treatment-resistant depression, they probably need a infusion, which is something that I don't do. I do it for clients as an integrative approach to the care that they're already getting with me. And so I think it's great to augment and complement the work that we've already been doing. And because usually we can get really far with the traditional approaches. And it's just, if you're looking for another, to meet another edge or to go a little bit deeper, we can introduce this. And the thing that I love about the psychedelic approaches is it can, not always, but it can catalyze the healing process because of what happens neurochemically in the brain with the pharmacological impact. So you get more regions of the brain talking to one another, which enables you to access different resources and problem solve differently. And in the realm of trauma or things that are difficult, what it does is it reduces the fear response. So a lot of times, one of the things that can be prohibitive in making progress is you have this issue and then you have subsequent anxiety, fear, guilt, shame around the issue. So say for example, sexual trauma or something happened and there's embarrassment and there's shame. That prevents you from experiencing that or releasing that. So what the ketamine can do in that case is kind of reduce the fear response so that you can see that incident for what it is and allow the processing to happen. Because I think with trauma or with hardship, there's processing that leads to resolution, at least from my experience. And sometimes processing gets blocked because hypervigilance, hyperanxiety, fear response, paranoia, flashback, you get paralyzed in that. And so what the psychedelics can do is really gently and beautifully kind of push pause on the panic button and allow you to kind of process in the way you need to process, and even somatically allow the body to move how it needs to move within a really safe space. And I think it can enhance rapport between patient and client. I think it can lead to different insights and new insights that could take a little bit longer with traditional psychotherapy. And it just kind of softens, or it can soften that experience a little bit more in some cases. And so I think that, yes, what you said is interesting about the war on drugs. And I know it's a controversial topic right now.
Yeah.
And it's also, I think it does. The ketamine feels good because what happens is, because it's a dissociative anesthetic. And so for that period of time, you're kind of lifted from how you normally experience your trauma or your anxiety. So if you're always kind of tight and just on edge and your heart's racing and you're always kind of balled up in your stomach, you kind of lift from that. So for that 2 hours of time, you experience, wow, what is my body like without holding this trauma in my back, in my throat?
Yeah.
And that creates hope, because it's like, whoa, and you gain new insights into things. You say, wow, I think that this tension in my back could be related to not being seen and not being heard by my caregiver in childhood. And if I really lean into that, it can actually ease some of that. So it does feel, good. There can be relief from that. And I think that can be misconstrued too, because it's sort of like, is this an escapism thing? And yes, in some cases it can, but I think when used appropriately and used at the doses that because I keep dosing very low in the way that I work with it, because I think if someone's going higher, they need to go to an infusion site. But I keep doses low so that the patient can actively engage in the psychotherapy process while also being in tune with what's going on somatically too. Yeah. So it's a lovely addition to the process as well.
Yeah. Well, I love how clearly you talked about that. And there's a few things there, but one is that, treatment-resistant depression, that ketamine has been shown to be really helpful with. It's extremely hard to treat. That's why it's called treatment-resistant depression.
Yes.
It's a very serious thing, right? And so it makes sense that would require the infusion, like a larger amount and more care. And then, I think it's just a fact that some people, unfortunately, are stuck in, an experience of life such that the anxiety or the depression or the knot in the stomach that you talked about, or the tension in the back, or the feeling that there's something wrong, or whatever it is, like it's that's their reality for so long that they can't imagine what it would be like to not have that. And so something that could offer a window of conscious experience where they're alive and they're experiencing life and they're talking with a therapist that they have a trusted relationship with, and they're not in that shit that they've been in for 20, 30, 40 years, that's such a gift. Yeah.
And it creates hope. It creates hope and it goes into the ego dissolution piece by quieting the default mode network, which is where we develop our construct of self. So in the cases of anxiety or even depression, when you have all these thoughts, I'm so anxious, this will never get better, I'm not enough, I'm the failure, I'm the failure, I'm the failure, and that gets ingrained into your being, the ketamine all of a sudden lifts you out of that. So you can see, whoa, this is my life without this constant narrative that I am a failure, I'm not enough. My client this morning, I'm a piece of shit, this will never get better. It's like, whoa, and that gives hope. And I think what it also does, because of the neurochemical impact of the psychedelics, is it helps you to re-template and repattern that new narrative, and that getting distance. So you can kind of starve the old narrative and repattern something new, something like, I'm healing, I'm doing my best, I'm trying, I'm a human, things will get better. And so you have this it's almost like an added headwind than the traditional psychotherapy can give, because of the heightened neuroplasticity that the pharmaceutical effect creates. So it almost gives it more bang for your buck, When you add the neuroplasticity with the fear extinction, with the heightened rapport with the therapist, with the active psychotherapy, it's like, that's why they say it's like, you know, having 10 therapy sessions in one with the psychedelics is because all this happens very quickly, and you can kind of recalibrate because of all these regions of the brain that are working. And so then the brain kind of resets and says, whoa, okay, we can get rid of that old narrative that says I'm not enough and I'm a failure. And we can have some hope to say, wow, I'm learning, I'm a human, I'm doing my best. And then to kind of go that way. And then that becomes the new norm. And then that becomes reinforced in subsequent and follow-up therapy sessions as well. So it's just, it's fun. And I love talking about ketamine, but sometimes there's like, it doesn't work for everyone. It's not a magic bullet. And the way that I work with it is very, just very different. So, yeah, it's not for everyone. And, but for those who it is good for, it can be really, really potent.
Yeah. Potent, powerful tool. It's a good like tool in the toolbox. And
yes,
I think one thing you said, you know, it could be an escape, or, you know, it obviously can be potentially abused, but using it within the context of a therapeutic relationship, to me, makes obviously such a huge difference. Like if you're being a good therapist and being really with someone, you're not going to be letting them escape, so to speak. You're going to be actually doing the work that needs to be done there, the process, or which could include, again, experiencing pleasure. It doesn't mean you have to like always be looking at the difficult things.
Right.
But that it's in relationship with a human. You're not escaping from that.
Mm-hmm. Yep. And even recognizing if you have the pull to want to escape, I think just noticing that, like, whoa, because sometimes challenging things can come up and our response is dissociation. We just disconnect. And so being able to stay and think like, wow, I can notice my own pattern coming up of just checking out, but I'm going to stay. And having the rapport with the therapist to say, yes, and I'm with you. Let's stay and face this memory or this difficult emotion and be with it. That's incredible. It's incredible. And that just, I think, solidifies more of the trauma resolution too.
Absolutely. Yeah. Mm-hmm. Well, thank you so much for being on the podcast. This was great. I think this will be really helpful for people. Do you have any last words to share with us?
Yes, I wanted to say this, and I'm glad you brought it up. So one of the other things that we teach and that I want to leave for all the listeners is I call it anchoring and using, I'm a big proponent of touch and hand to body, and this technique that I teach a lot of clients when they are feeling overwhelmed by the moment, stress, anxiety, panic, is to come back by one hand on shoulder and one hand on your abdomen, and kind of that helps anchor into the present moment. And if you can, close your eyes and take some breaths. And even reminding yourself or reminding your body that you're here. I'm here. I see you. I'm with you. I'm in this. That can be something that's really empowering. It's called a grounding technique, but it does, I think, one of two things. One, it can prevent or lessen the dissociative response. The dissociation is one of the things that makes panic, anxiety, and PTSD so scary, is we just kind of check out when the negative emotions come, or we just get pulled into them. So it can really help to anchor and ground and come back. And then I think it also provides nurturing. So the body nurturing piece where you can say, hey, I'm here and I'm with you, and just say positive affirmations that you're needing most in that moment. Whatever your body needs in order to feel safe or feel empowered. And that can differ from person to person, but just being able to connect, because I think we can label it all differently, anxiety, depression, PTSD, but I think it all comes down to a disconnection from self, because you leave yourself and you feed those depressive thoughts. So enhancing the intimacy and connection with self is I think the goal, and something that leads to the symptom resolution, the relief, and then the pleasure as well. So I hope that I think that everybody should try it. It's great, and it
I love that.
leads to a lot of relief for a lot of our clients. So
I love how you said connection with the self.
yes.
And that some of the negative self comes from when you leave yourself. That really struck me.
Yeah, and even with addiction, I mean, I'm not an addictions professional, but you leave yourself and you go to the addictive behavior. And I think it happens with panic, with anxiety, with flashbacks, with dissociation. You just leave yourself, or if you engage in unhealthy behaviors. And I think healing comes when you come back, and that can look different. It doesn't have to look perfect, but when you come back and you say, hey, why did I want to leave? What part of me was not being tended to or nurtured or seen or loved or held? And how can I hold self and connect? And it's really beautiful when we're able to kind of see that and do something different. We come back to ourselves.
Come back to yourself. I love that. Well, thank you.
Yes, you're welcome. Thank you. This was so much fun. I just love talking to you, and I'm so glad I got to get to know you a little bit more too.
Yeah. Thank you.